When we're talking about depression, it's really easy to imagine it's an intractable and chronic problem. And the reason we tend to think that is because we've used ineffective treatments for years. The oral medications we use were studied to create a 50% improvement in your depression symptoms. So the best we were looking at was, does it make you half as miserable? And predictably, half as miserable sucks. It's still depressed, and we accepted that as good enough. With neuromodulation, the endpoint we use in our studies is different. It's remission, your depression being over. And it turns out when you look at remission, you're able to see much bigger differences in research, and you're less likely to fool yourself into thinking you saw something or felt something when you really didn't. People often ask, well, how can you tell? Isn't there a placebo response? Well, in some conditions there is, and in some there isn't. I'll give you an example. Parachutes. The success rate of a placebo parachute is 0. And so we don't need hundreds of participants jumping out of planes with placebo parachutes that don't stop their fall. That would be unethical. And so we don't do it. We understand that falling from a plane will kill you, and you don't need to study it endlessly. There are some kinds of depression that are much more similar to jumping out of a plane without a working parachute. And throwing, little umbrellas at it as the treatment are not effective for those individuals. And their depression, well, it needs something more potent. And the best thing we've discovered thus far is transcranial magnetic stimulation done in an accelerated fashion. So it stops the depression and suffering fast. It works more than half the time. The worst interpretation of the data is 65% of people having their depression be over, and the best is 79% will have their depression be over. Done.